Well, I've been in practice here since 1998.
I've always wanted to join my dad in practice. I came here as a kid growing up, so I got adjusted after all the sports, all the injuries, things like that. And now that I'm finally here on this end of it, it's been a lot of fun. I've seen some injuries. I spent the last 4 years in the Army, so heard a lot of stories of people coming out from injuries and motor vehicle accidents, and I just want to make sure that we are able to see those things on x-ray so that when we're treating them, we know everything that we possibly could know about their spine before we start doing our adjustments.
X-ray gives you another level of certainty of what's really inside the patient that you can't see, and it just gives us a nice base to go off of.
A lot of our assessments are always with assessing the spine with range of motion, static palpation, things like that. But when we don't have the x-rays, it's really hard to tell if they have any curvatures or lateral rotations in the spine. And when we can see that, it kind of opens up a whole new level of a dimension that we didn't know before.
Yeah, this is not a very large room, and so we're using every square inch of this space. And the way the machine fits in here, it's going to be pretty, I think, pretty good ergonomic.
My dad has always trusted Brown's Medical Imaging for these sorts of technologies, and so when we were looking for him, he just knew right away that that's what he wanted to use.